Hello everyone, welcome back to iSmile. This is Dr. Projjal Haldar. I am a consultant dental surgeon from India. Today I am going to discuss a case. This case is a perfect example of mild symptom but that requires a major management. Patient came to me with mild pain in tooth number 101 or his maxillary right incisor with a little bit of mobility. Intraoral periapical radiograph was taken, which reveals horizontal fracture below the crestal bone. Now, that makes the tooth unrestorable at all. So, our initial plan was to take out the tooth followed by an immediate implant. So, we are proceeding for CBCT. CBCT reveals a very thin buccal bone in around 0.5 mm or so. In order to place an implant, bone grafting is required. Not only that, but in order to achieve a proper aesthetic contour, further surgery may also be required. But the patient needed an immediate solution. So we made some changes in our initial plans. We moved to teeth-supported fixed dental prosthesis. As you all can see, patient having great amount of stain in his teeth. Before jumping into any treatment, we do a quick oral prophylaxis and recall the patient after 1 week. Because I believe foundation of any dental prosthesis is lying on good periodontal health. But you can see the amount of stain is reduced, but it is still there, and that is quite unsatisfactory. With any sort of treatment, preservation of buccal plate of alveolar bone is essential. So, the procedure was planned accordingly. First, the abutment teeth were reduced under local anesthesia. Then, the coronal portion of the fractured tooth was removed. Now, we need to preserve the buccal bone. At the same time, we need to extract the root fragment. For that, we need a special instrument known as periodome. Periodome is an instrument having a thin blade that can enter the periodontal ligament space. After entering the pedial space, with gentle movement, we can cut most of the pedial. And we were doing the same thing here. One should be cautious because the procedure demands patience for its time consuming. 15 minutes or so into the procedure, we were certain that most of the periodontal ligaments were removed. The time has now come to extract out the tooth. A55 number H file was inserted into the canal space gradually. After engaging the canal space, by gently pulling it, we removed the tooth out of the socket. If we give a fixed prosthesis now, that will help us to create an Ovate Pontic receptor site. This case won't require any sort of grafting, but to reduce the risk factor regarding the alveolar bone resorption, we give a collagen graft, mixed with a platelet-rich fibrin graft in the socket. Provisional prosthesis was given in the same day. The patient was very happy as well. After 3 months, we called back the patient. As you all can see here, the Ovate Pontic receptor site was beautifully created. Now we are going to give the final zirconia prosthesis. And that's all, folks. A very special thanks to Dr. Jabojyoti Mondol, who was assisting me throughout the procedure, and thanks to my beloved brother Saurabh Kirtania for making this video possible. Thank you for watching our video. If you have any question, please ask them in the comment section below. Suggestion to improve our content will be greatly appreciated. Please like, share, and remember to subscribe our channel for more such contents. and I'll see you guys in the next video.